Hello, today we want to discuss about electrolytes. Electrolytes and then the importance of potassium being the most important of them all. They're all important actually, but the function of potassium is what makes it spectacular in the body. Let's dive into it. So now let me explain the electrolytes in the body, the major electrolytes in the body: calcium, magnesium, sodium, and then potassium. Now, potassium being the most important electrolyte in the body. Why? It is responsible for the chemical impulses in the body. It raises every heartbeat that we get, the muscle contractions, the movements, each time you run, each time you raise a spoon to eat, each time you carry a lift up in the gym, anything you do, electrolyte, potassium is working. So now, not just that, when you talk of nerve signals and impulses, without potassium, that will not happen adequately in the body. Sometimes we see our legs, we feel cramps in it. It's as if though it's season. It's as if though you're getting palpitations. It's as if though you're feeling some kind of nerve tingling in the body. Potassium is responsible for that, especially when it's low. So now we are going to talk about why it's important. That's the benefits of potassium. We are going to talk about why we do get deficient in potassium. And we are going to talk about the functions and the signs that potassium is low. There's a little diagram here. This is called the sodium potassium pump. What is the function? As you see here, I wrote below battery. Battery in the sense, not like the battery of a car, but like is what makes your body come alive. And it's called the sodium potassium pump. What does that do? Sodium in the body causes water retention. And the work of the potassium in a cellular level is to keep that sodium out of the cell, the excess of sodium out of the cell, and then the potassium in. That is the function of this pump, this sodium potassium pump. Sometimes you can see people, they appear puffy, puffed up, swollen, if I may say so. On some people, their legs are swollen and they get scared. Maybe it's something like they think, oh, do I have elephantiasis? Elephantiasis is when your two legs, it could come in one, but later on, any which way is going to come in the two. But that's not it. You see, you press your body, your feet especially, or your palm, or your face, you will see a kind of indentation, as if though the body sinks inside. At that time, what is happening is that you're having excess water fluid retention in the body. That fluid retention, the name is called edema, which is here. They say potassium prevents edema. But we are going to come to that. That's the benefits of potassium. So now we come to functions of potassium. They say it generates nerve impulses. It makes muscles contract. It helps regulate body pH. and it helps balance fluid, which is the same as preventing edema. So after the functions, what is the nerve impulses? Every single thing you do, the impulses in your body sends a signal to your brain. Oh, I need to blink my eye. Oh, I need to get up because I want to go drink water. Oh, I need to go to the gym, and when you get there, something tells your brain, oh, it's time to lift. You lift, but then again, it comes, muscles have to contract. If it doesn't, then you have what is called, there is a word, as if though your legs are shocking or your legs are seizing. The movement isn't free. That's you're not having proper contraction. And in all this, least I mentioned, this potassium or the electrolytes comes as an infusion because, as I said, calcium, magnesium, sodium, potassium have a certain milligram a day that we need to consume, that the body needs to get it in order to function optimally. For calcium is 1000. For magnesium is 420. For sodium is 1005 to 2300. And then we come to K plus, which is potassium. You need 4700 every single day. And what food can give you potassium to this level? It's very hard. Unless you get like maybe 10 little cups of a salad, that could help. But I wouldn't, bananas give potassium, but bananas, you need, every one banana that we eat has about, is it 300? Gives you about 300 milligrams of potassium. So what does that mean? It means before you get your daily requirement of potassium, you need to divide 300 into 4,700 to tell you how many bananas you need to eat. I will leave all you, my viewers, to punch your calc and know how many bananas you need. But where that has a problem is that bananas contain a lot of sugar. So if you're hypertensive, let's say, if you're pre-diabetic or you're diabetic, that means banana is not your best option to get enough potassium. Again, avocados. Avocados are a good source of potassium. Actually, I just had one avocado before I started this program, because you will sense when there are times you stay, either you're too hungry or you're fasting and you suddenly feel dizzy or you get heart palpitation. At that point, your cells is lacking potassium. Either you go and get an electrolyte and drink even when you're fasting. That keeps your system more stable. Now we go over to why do we get deficient in the first place? Why does the human body begin to lack potassium? One, it could be as a result of your diet. As I said, you need about 4,700 daily. When your diet is based on majorly carbs. That says it all. You're not going to get this. And it's only a question of time before your body begins to signal you, hey, I need help. Hey, I need help. Then when you do a lot of vomiting, you're losing your electrolytes. If it's in the hospital, they give you what is ORT, oral rehydration therapy. That is for you to, they tell you you're weak. You need to regain your strength. At that time, even if you don't eat and they give you that ORT, oral rehydration therapy, you see that your strength comes. You're not as weak as you were before you took it. So the same thing goes with diarrhea. When you're having diarrhea, you're losing bodily fluids. And in that process, you're losing potassium and you're equally losing sodium. They are two brothers, or a brother and a sister rather. But one needs to be in a higher rate than the other. Then I just spoke about fasting. When you fast a lot and you drain out your system, you lose potassium. When you're diabetic, you equally lose potassium. That will be a topic for another day. How diabetics lose potassium. Sugar. When you have excess sugar, depletes potassium in the body. These are a brother and a sister. Diabetes, sugar leads to what? You're having what is called insulin resistance. This and this. And then alcohol, excess sweating. Now this excess sweating, my beautiful people, women of about premenopausal age and menopause, they notice they have hot flushes. They have this sudden rush of heat, sudden rush of sweating. They need to have these electrolytes, plus as a matter of urgency to make their menopausal process easy, they need to balance out the electrolytes in the body. Now we go over to excess water taking. That sounds funny, right? But when you have excess water, what happens? You pee a lot. As you're peeing, you're losing them. Excess stress, as the human body is, not just for potassium. Stress is bad. So when the body system is having issues with stress, you can be rest assured potassium is lacking. That is why we need to always visit the hospital or the lab to get ourselves checked. So now we'll talk about signs of low potassium in the body. You know, there are different things that can give off some of these signs that I'm about to mention. It's either you're having excess sugar, which could lead to peripheral neuropathy. That's when you have either pains at your extremities, your palm, your feet, or you experience tingling on your palm and your feet. But again, potassium can equally give off the same sign. The importance of this is knowledge. It's, when I go to the hospital, let's just say, anyone, you have an idea, could it be that my potassium level is low? Could it be my sugar is too high? Could it be this? Could it be that? At least this would get our brains working. let's get into it. So now you can have, when your potassium is low, you can experience tingling and numbness. High pulse rate. Oh wow. This one, I for one, I used to experience it, but now I know how to curb it. It could be named tachycardia. It could be named arrhythmia. But a simple man's word, high pulse rate. That is when you put your finger underneath your neck and you feel your pulse overbeating. This doesn't mean that you're hypertensive, but it means you're tachycardic, which can equally lead, it can equally lead to stroke. Let's just put it like that. When the heart is overworking. Frequency of urination. Some people say, oh, I urinate a lot at night. Maybe I'm diabetic now, and they go run a test. Even their A1C is fine, their sugar level is fine, but they see themselves waking up at night to pee. They should check potassium level, because at that point potassium is too low and you're having high sodium, water retention. Remember guys, edema. That's it. That wakes you up at night. Then the same high pulse rate. Here it comes heart palpitation. Then you have constipation, bloating, water retention. It keeps coming up. Insulin resistance. As I said, another topic we're going to have for why you get deficient when you're diabetic or when your sugar level is high. It relates to this coming up as a sign why you know, or how you know that your potassium is low. Insulin resistance, because when your system is experiencing this, you're only a short distance to this diabetes, which is nobody's friend. That's responsible for most of all the sicknesses in the body: stroke, bad eyesight, liver issues, kidney issues. That's the enemy of the body. Some people say, by the way, sorry to sugar lovers, but they say sugar is like a gift from the devil. Not really, I do drink Coke. But now we go over to benefits of potassium. When your potassium level is high or it's normal, endurance, it gives energy. What's endurance here? For people who are weightlifters, for people who exert themselves daily, for mothers who stand cooking, who stand keeping the home, who stand working in the office, who just multitask. If your potassium level is on point, that is the endurance. That's the energy. Right now, I told you just before I came here, I had one avocado. As you can see, I seem to be doing good. There might be bad days anyway, but I'm doing good for now. It prevents cramping because potassium helps out with what you call vasodilation. It helps your cells, your nerves to relax, for them to be able to give you the right impulses, for them to be able to function and give off the right energy to the body, to the battery of the body. The next one is tremors, twitching, constipation. When you talk of these tremors, remember I said this is about nerve signals and impulses. Now, when the nerves are stressed, they send out wrong signals. And then, what are tremors? When you feel a sudden shiver, you hold onto a cup, or as I'm holding this pen right now, my hand shakes. It shakes, and then I try to control it. Either I put my hands on my back or I hold them together. I've seen a couple of people who experienced that, and I felt, oh shit, should I walk up to this person and say, hi ma'am, hi sir, could you try checking out your potassium level? That might be the cause, might be part of the cause of the problem. But you know, we all get to not pass our boundaries, and moreover, I'm not a medical doctor, I'm an aesthetic doctor. So do always remember, visit your doctor, but this gives you an insight to what could be happening to you. After the tremors, twitching. When you feel, some people call it, oh, I'm having muscle pull. I'm having muscle pull. You touch your legs, your arm, it could happen anywhere. You feel twitches. They keep coming. It's a signal. It's low, and then as a benefit, when it's enough, it stops it. It stops these tremors. It stops this twitching. It gives off right pH. I said functions. One of the functions of potassium is it helps regulate the body pH. We have this pH everywhere in the body. There is your tummy pH. There is your vaginal pH. You can count. And then we come to, we are back here. You see, insulin resistance. Here it shows as a sign when this is happening to your body. But here is a benefit, that is when you have enough of it, you will notice that it prevents what? Insulin resistance. It helps with vascular calcification. It means it helps to direct the sister calcium to the right place it's supposed to be. Calcium is supposed to go to your bones, it's supposed to go to your teeth. But when you begin to have calcium deposit on your soft tissues, it becomes a problem. Again, we go over to insomnia. I said earlier, what's insomnia? Insomnia is when you can't sleep, when you have difficulty sleeping at night, when you have this whole electrolyte, this potassium, again magnesium, when they are in the right proportion, it helps your nerves. That nerve impulse signal is telling you relax. What they call circadian rhythm, it's nighttime. You need to relax. When it's enough, insomnia will not be part of your problem. High blood pressure. Okay. We go back to the battery thing. This potassium that is an electrolyte, you can't patent it. It's for everybody to go and get. So you will never see anybody say, oh, your BP is too high, take potassium. Nobody will tell you that. But in every blood pressure medication, if your doctors or a pharmacist would tell you potassium is there. So that helps with high blood pressure. It does protect your kidney. It helps out with kidney stones, just like magnesium. It makes stomach acid. As I said, it regulates pH. The stomach is acidic. If not in the right pH, food digestion becomes a problem. Prevents edema. Already discussed the swelling, the indenting on your feet, your ankles, your palm, the puffiness on the face, the lower eye fluid retention. Again, it helps with the lymphatic system. Sorry, I'm going that way because I touched the under of my eye. You see certain people, they have bags under their eye. Sometimes all you need is a lymphatic drain massage to get that sorted. And as I said, this helps with the lymphatic system. Potassium helps with the lymphatic system. They work together. By the way, we have a very good massage system in my clinic. You can try it out, but that's another day. Then it counters sodium toxicity. Sodium toxicity, that's this. When too much sodium in the body, the puffiness, the edema, the palpitations, the low energy, this potassium counters that. That's why electrolytes being balanced in the body means you're good to go. Then I mentioned gout, pain in the ankle, pain at your thumb, at your toe. Potassium, a regular level of potassium solves all that. So now we've had a brief insight on what potassium does and how important it is to the human system, male or female. We have a brief talk on the other electrolyte functions. That's calcium. As well, it controls muscle contractions, nerve transmission, and blood clotting. Magnesium controls electrical impulses. As I said when discussing potassium, I say it works. They're like sisters and brothers. They work together. In fact, all the electrolytes work together, but potassium is a little bit different, so to say. Not different, they are all the same, but the functions are really important to the human body. And then you come to sodium, managing, as I said, body fluids, blood volume, nerve signals, muscle contractions, and blood pressure when in the right proportion or in the right ratio. That is all of this. This is the right ratio for calcium, or the right quantity, the right intake every day is 1,000. 420 for magnesium, 1,500 to 2,300 for sodium, and then 4,700 for potassium. So with this little insight on the need for the electrolytes and potassium being quite important, now what I would say again is why it is important to have it as an IV infusion. I can't talk about that enough. When these are low, as I said, why they are deficient, all of this. When you say, I want to eat, there are things that will obstruct you within your digestive tract, that even these levels, these quantities, by your diet, even when you're eating right, the tendency that you're not going to get this amounts daily is off the roof. For women with endometriosis, with men with ulcers, with male, female with IBS, irritable bowel syndrome, with different people with wrong pH, making the acidic level in the tummy difficult for digestion, for people with leaky gut, for people with polyps, with people with fibroid. All this causes some form of indigestion. And the quickest, fastest way to deliver these electrolytes into the body is by infusion. However, you need these infusions done by someone, an expert that is knowledgeable in making sure the ratios are in order, because this and this, your kidney speaks to them and they speak to your kidneys. It is not something you go to just anyone to do. You need it done by a practitioner that knows his or her onions, or with a certified medical doctor, or a certified, well-informed, educated aesthetician. I do hope that this that I've brought to your attention is utilized in the best way. Don't go saying, oh, I heard potassium is the reason for all my problems, or electrolytes are the cause of all my problems. Remember to always run a test. Before I do it, I have an in-house lab where I check out your electrolytes. Which one needs tweaking? Which one needs to be left as it is? It is never a uniform treatment from person A to person B. It should always be personalized. It should always be tested before treatment. And as I say, you're happier. Life is sweet when lived healthy and well. So coming from my clinic, I would say do have a nice day and see you again in another episode. And as always, clock it.